of this event for the invitation. And of course, and working all the logistics and all that to make it possible. And all of you for your time and willingness to be part of this conversation. So I'll try to stick to the 20 minutes just so that we have enough time to actually exchange. You know, a couple of weeks ago when I was thinking about a name to put to this talk or this dialogue, I eventually decided on Hacer pueblo, which in Spanish literally means to make community. And those are words that I took from a pretty well-known phrase, at least in leftist circles here in Mexico, a phrase by Lucio Cabañas, who was a campesino, a teacher, and also the leader of one of, I'd say, the historically most important and influential armed movements in the state of Guerrero in Mexico's southwest, which is where I do quite a bit of organizing work that I'm involved with. And so I'm hoping that making community or hacer pueblo and healing through that will be the main focus of our exchange today. But I do want to give, I guess, a little bit of context and background since we're on either side of the colonial border that sort of separates us. And bring that context specifically to these past few years of pandemic, since it's unfortunately a situation that really all of us have kind of been going through. And so my particular vantage point, as Meg mentioned, I trained as an emergency doc and work at what is known here in Mexico as a level 2 regional hospital, and it belongs to one of the various public health systems in Mexico. So for those of us who aren't that familiar, Mexico has sort of various parallel public systems which cover different parts of the population depending on whether you are a public servant, teacher, a worker in general, a worker of the national oil and gas company Pemex, which has its own health system. There's another one for those who belong to the armed forces. And then there's supposedly this totally accessible public health system for those who don't belong to any of the above, which is run by the Secretary of Health, Secretaría de Salud. And of course, there's the whole private system. And I say supposedly totally accessible because, of course, if we talk about true accessibility to healthcare in Mexico, it's a pretty dismal situation. And I think if we go to the usual ways we think about quality in healthcare, neoliberal policies here in Mexico, as in the case in the rest of the world, have over time really dismantled social security here. So in the public healthcare systems, that means being totally understaffed, having really outdated, oftentimes downtrodden physical spaces in terms of health centers, clinics, hospitals. So it's hard to provide dignified care to folks. And of course, there's huge holes and gaps in terms of medications and supplies. So this isn't the best of situations often, right? So even in the completely public system, people often have to pay for tests that aren't available at their hospital, buy their own meds, etc. And this happens to us all the time, even those of us who work, for example, for the healthcare system. And then, of course, I think if we look at more closely at this idea of accessibility and talk about those sectors of the population that are usually invisibilized in terms of their needs and how those needs are being taken care of. So folks in the more marginalized areas of cities, informal workers, which make up a huge part of the workforce here in Mexico, migrants and refugees. And I think probably the most poignant example of this being folks from Indigenous communities. We start seeing regions that have actually very little presence of the healthcare system. So it's not uncommon for folks to have to travel hours sometimes to get to a hospital where they can get care. And if they're able to access that care, they're often on the receiving end of pretty racist, misogynist, and classist treatment by healthcare professionals. And so this is across the country, and particularly, I think, present in the southern states of Mexico. And in terms of Indigenous communities, I think, as is the case in the US and many other countries, in numbers, of course, this translates to a lower life expectancy, a higher maternal mortality rate, which I think is 3 times higher than the general population, and of course, a child mortality rate aside from malnutrition, higher numbers of preventable illnesses, etc. So really, of course, I think we'll all agree that access has to do with much more than just being able to get to a clinic, and it's quite terrible in many regions of the country. And this was pre-existing, of course, to COVID, right? And all of these inequities, of course, were made more acute and drastic during these last 2 years due to the pandemic. And perhaps some of you have read that Mexico was one of the countries, sorry, with the highest death rate among healthcare workers across the globe. And of course, there was some recent data that I was looking at that was compiled to show that we've also had one of the highest rates in excess mortality across the board, right? So not just limited to healthcare workers. And there's been, of course, complete denial from the federal government about this, and this total like gaslighting situation, including the Subsecretary of Health, Hugo Lopez-Gatell, who was also otherwise known as Mexico's COVID czar, right, or the expert on COVID, and the one to put forth or at least voice the official policies and how the government is looking at COVID here. And of course, and unsurprisingly, a lot of that excess in mortality has been particularly offloaded again onto informal workers, folks in transport, like all the frontline sort of folks besides healthcare workers who have been on the front line in terms of making society move during the pandemic, middle class and poorer women, and of course, folks from Indigenous communities who've had a higher, relatively higher mortality rate compared to the general population. And so that's sort of like the panorama, and I think things that people have access to, at least in the news. And I kind of want to get a bit more personal here to give you an idea of what things have been on the other side, or the insides, I guess, of the walls of clinics and hospitals here in Mexico, because it's something that I think due to fear of losing one's job and a lot of these situations and pressures, of course, from our employers, it's things that probably haven't been spoken about so openly, at least in the media, and hard for folks to have an idea of. And so I want to talk a bit about my personal experience as a quote unquote frontline healthcare worker in the Emerge, because I think what I have seen and lived through during the pandemic in sort of institutionalized healthcare in the midst of this situation of basically collapse created by capitalism is pretty necessary to understand why it's so urgent that we have to start organizing ourselves in very different structures of healing and mutual aid, right? So I find myself right now talking about the pandemic sort of in past tense, though it's not. And that's probably just because the major surges are sort of like right now behind us. We'll see if we get another one. Here where I live in the state of Veracruz, we're just sort of coming out of the third wave. But so I think a lot of what I'm going to be referring to happened last year and at the early end of this past year. So during the major surges of COVID, at least at my hospital, which serves a large part of the population of the state of Veracruz, it's considered a hospital that has higher end care for the public system, in that we have an ICU and ventilators and all these things which aren't even available at smaller hospitals. So I think some of the hardest things to witness were, of course, people coming in sick, oftentimes not having enough access to oxygen and beds for folks. And then, of course, as soon as people would come in for this risk of, the infectious, obviously, risk, people being separated from their families, oftentimes in the case of people who would pass away, which were, I think our mortality rates for folks at least coming in with severe COVID were above 90%. And so it was the last time that they were seeing their family members and were left basically alone, right? Besides the contact that they could have with the healthcare team, which could be quite often and constant to sometimes barely nothing, depending on how understaffed we were compared to the number of patients coming in. And so some of these stories I was told about because the situation on the wards was even worse than in the ER, where we had, I think, closer contact with our patients. But so I was told about patients who didn't eat, for example, during days if there was no one there to actually help them. There were, at least I think at our hospital, one case of a patient committing suicide by jumping out of the windows of the 5th floor of the hospital, just because of anxiety and fear and just not having enough personalized care. So there were folks, you know, who had, I guess, like their bedpans full and not changed sometimes for a day or two, depending on, you know, how many people were there to help them get that done. And, you know, all of these things that are so essential, I think, to healing, which is like nutrition and that close contact with folks and just the emotional and mental support, besides just getting through, you know, like the physical aspect of the illness, was completely taken away from folks, right? And so people were there dying oftentimes alone, far away from their loved ones, without any sort of contact with this totally essential support network that would be necessary, I think, to heal from an illness as difficult as COVID-19. And it's, you know, been so hard to imagine just like that tremendous loneliness and terror that people live through, even though I think to date, I'm still like carrying a lot of the terror that I would see in people's eyes and faces and just body language when they were with us in the ER. And the pictures that you shared at the beginning of this were, some of them were pretty hard to watch because of just like thinking through all of that again, right? And I think, you know, these terrible conditions, and this wasn't just exclusive to my hospital, because we heard about these things happening at other places, and probably even to a greater degree in hospitals that were even worse off in terms of resources. And I don't think that the majority of these terrible conditions, in the majority of occasions, were a result of cruelty. In terms of those of us working at the hospitals and clinics, I do think to a great degree, they were the result of totally inadequate structuring of healthcare services during decades. And of course, you know, this increasing pressure to privatize healthcare, and so this dismantling of the public systems. And oftentimes we just didn't have what to give more with, right? Not enough people, not enough space, and not enough equipment or medications. And of course, on top of all this, I think there's been this coming apart of the relationship between the healthcare sector and the population, which has gotten like more heavy or more acute, like as time has gone by. And in this context, I will say, you know, as a criticism or self-criticism as being part of sort of the workforce of the healthcare system here, I think in particular, a lot of doctors also fell into sort of this normalization of suffering. And I think that is true. And there was kind of this justifying, right, of all of this with this kind of learned helplessness of it, you know, we can't do more and we're already overworked, and so we can't really change this. And we did question and criticize our working conditions often, because there were quite a few protests and marches and work stoppages across the country, including in the city where I live. But I think few of us got to the point, or have gotten to the point, of questioning the kind of medicine that we're practicing and how it's practiced and why we're practicing it in this way. And few of us have questioned ourselves as part of sort of this model of healthcare attention that isn't always, I think, in focus really on healing and curing in its true dimensions, and actually is a model that seems to have to perpetuate itself constantly, even at the cost of those of the population who are coming to us and looking to us for help. So few of us, I think, and this has been kind of disappointing to me, because I was holding out hope as the pandemic started, and was seeing all these protests and marches, and seeing colleagues of mine even in marches and protests that I'd never seen in the streets before. And there was a sense of hope that I had that this would kind of help to bridge that gap between healthcare sector and other sectors of the population. But as time went by, I haven't seen that happen. And so I think few of us have kind of like turned around with curiosity and humility to look at other systems of healing and other ways of curing and healing, and how to accompany the sick and how to accompany illness. And I think that would have probably helped us sort of reevaluate the biomedical model that we're kind of a part of, and see what we've been doing wrong and how we could actually help people in a more meaningful way. And so I think prior to the pandemic, of course, I'd thought about and reflected on the holes in the biomedical model of health many times, but I do think that the pandemic, and just witnessing all of these absolute contradictions that it brought to the fore, and participating in them, really pushed a lot of my questions and critiques and self-critiques to like this other level, right? And I want to, all of these questions were intensified by an experience that I went through in early May of this past year. And I'd like to share that experience with all of you to sort of get more into what some of us here and friends in other places like Colombia are calling health with territory, as opposed to these totally colonial, patriarchal, vertical structures of healthcare. So in the early days of May, we found out that a wave of COVID, the first actually since the pandemic had begun, had hit a community in the Montaña region of Guerrero. This particular community is a Mepa community. So Mepa is one of the nations that exists in the state of Guerrero, Indigenous nations. And this community, which is called Silacayota, and is actually my partner's father's natal community, is about 5 hours away from the city of Tlapa, which is like the closest large city in the Montaña. And it's the closest location of a public hospital, right? So 5 hours away from the pueblo. There is a small healthcare center in the community with one doctor. However, unfortunately, by all accounts of folks from the community, and we spoke to many, the service provided by the physician is terrible, and he had actually refused to attend anyone with symptoms suspicious of COVID, right? So when folks in the community realized that something out of the ordinary was going around, 3 people had already passed away, including, unfortunately, one of the spiritual guides of the pueblo. And by the time I was able to get there, a total of 4 folks had died. So we had to kind of put together this like emergent plan, which are often imperfect, but had to work with what we could. So what we did was have the comisaria, which is sort of like the local community government, along with the men belonging to the community police, announced that we would be doing home visits so that all of the families who wanted a consult could ask for one. And then when I was able to get there, we were there for about 2 days. Unfortunately, wasn't able to spend longer. And we visited about 26 families who had asked to be seen and had 1 or more family members who were at different stages of COVID. Some of those families had family members who had passed away in the 2 weeks prior. And so we walked around the community from home to home, escorted and accompanied by the members of the community police with really basic instruments, you know, conversation, eyes, ears, hands, a stethoscope, a thermometer, an oximeter.
Hey, Manny, sorry to interrupt. You got very quiet. I think a big truck went by and then you got quiet. Yeah.
So I'll just start there again. Yeah, I was mentioning to Megan and other folks at the beginning of this that I live on a super busy street, so I apologize if there's a lot of noise all of a sudden.
It's still a little quiet. So I don't know if your microphone, I don't know if it like Zoom did something to mute your microphone, but.
Okay, let me just again. Can you hear me now?
It's still pretty quiet. I don't know.
I'm not sure what happened there. Hello? Is that okay? Also no.
It's just got, yeah, it's still pretty quiet. I don't know if you can go to your, next to the mute button, a little arrow, and then go to the audio settings and turn your microphone level higher.
Okay, let's just see.
Sorry to interrupt your story. Oh, now I can't hear you at all, I don't think.
How about now?
Yeah.
Is that better?
Yes, much better. Thank you.
Yeah, I'm not sure what happened, but so yeah, sorry about that. So I was telling you, so we're in the community and we did the home visits. And, you know, that was basically talking to folks, examining them, and then we shared, you know, really basic methods of care, including some basic medications for some folks that we actually took to share with people. And then, of course, some recommendations in terms of food and just some of the medicinal plants that are available in their territory, certain positions to take while resting, and breathing exercises, right? So really basic stuff is what we were able to share. And I remember we saw at least about 5 people who, by any criteria, would be graded as severe, having severe COVID. with oxygen saturation levels that were in between like the 70s and low 80s, right? So there was, of course, no access to supplementary oxygen in the community or nearby. There was no nursing care nearby to kind of put in place more advanced medical care for when I was not going to be able to be there any longer. And of course, I think it's also important to mention that there's quite a bit of distrust towards the medical institutions for all of these historical reasons, which was going to make it difficult to make sort of like a wider public call for outside help on such short notice without going through that with the community members and coming to some kind of an agreement about how that could be done in a respectful way. And getting people transported to the closest public hospital wasn't an option either, since we knew that in the hospital of Tlapa, there was no beds available, people were being turned away, and the care was going to be totally inadequate. And so we'd probably be sending them, you know, to a worse situation. So, you know, it was pretty heartbreaking to be there and pretty worrisome. And I just remember, you know, that acute frustration at hearing, on the one hand, all levels of government saying that things were pretty under control in terms of COVID in Mexico, and having these situations happen at the same time. And I remember in the 2 days that we were going around in the community and visiting folks, I didn't see the doctor from the Centro de Salud even once, right? Attending people. What I did see, however, was just this abundance of care within families and networks of families, and just this willingness on the part of people's daughters and sons and wives and brothers and sisters to learn how to look after their own, being really present despite, of course, all risks to themselves and to their own health, in terms of learning how to give them the proper nutrition, give them their medications, and just sustain them with presence, right? And so I also saw pretty good organization in terms of the comisaria and the community police that allowed us to do these home visits in such an organized way and make sure that no family that had asked for care or help was denied that. And I also learned about, through you know, my partner and his family, how folks had even pulled through, I guess, like the last rites and rituals for folks who had recently passed away. And that I know is something that has been totally criticized by folks sometimes, in terms of being like, why aren't people observing, you know, like all of the precautions in terms of the contagious nature of COVID, and still attending funerals and all of this without really understanding the importance of all of that at this spiritual level, right? And so what I did see, I guess, in all moments was this like imperative to think, feel, and heal themselves as a community, and if that wasn't possible, to also make community during death, which was pretty striking. And so, of course, in the days and weeks after that visit, I was totally worried, and also had this sense a bit of resignation in terms of getting bad news and hearing about at least those 5 or 6 people having passed away. And, you know, a week went by, and then another week went by, and we were sort of in communication with folks who were there, and what they told us was that no one else had passed away. And I was kind of incredulous, because by any counts of my experience at the hospital, none of these folks should have survived, right? And so I was left with this question, besides, of course, being super relieved and happy about this, like, what had they done? What had happened that prevented these folks from dying? And that's probably a question that I don't have a clear answer to, right? And I wish I did, because then we could just like package that sort of and bring it to other places. I'm sure some of it was just luck, but I do think that a lot of it had to do with just like the intense care that people did make sure to give each other with very basic, you know, the very basic tools that they did have. And I'm sure that had a great deal to do with the survival. But what I guess that experience left me really thinking, after having both gone through sort of the institutionalized biomedical healthcare model during the pandemic, and that experience in the Montaña, sort of made it really evident that thinking, feeling, and strategizing around healthcare has to move beyond this sort of dichotomous debate that we often get stuck in, of just, you know, public versus private healthcare, and always falling back on this biomedical model, but it's kind of either privatized or public. Over the years, I think through working with folks from rural, campesino, and indigenous communities here, and linking with folks doing that work in other regions and other countries, it's become really evident that we have to kind of break with this, I think sometimes co-opted idea of what community health is. And so, like, you know, it's pretty popular for the government to put through programs to train promotores de salud or health promoters. But it again becomes just this idea of putting like a clinic into a community, right? And with that, I'm not trying to say that communities don't need greater access to the public healthcare system, because I think that's a right and it has to be defended, and it's definitely true. But I do think that as folks who are concerned with liberation work, and I think what Rupa and Raj last month aptly called deep medicine, we do have to really understand from the ground up, and so from the diverse territories, what health means to folks, what illness means, right? And what healing means in those territories. And so try to build structures of care which do, besides helping, do the least harm, the least displacement of local knowledge, the least disruption of collective networks that have taken care of folks for centuries. And I think that would at least get us to start to move towards decolonization in medicine and healthcare. So with that, I'm not sure if I'm running out of time, probably. I just want to go to the last part of these initial comments to leave you with just like an example of how we've tried to do that in the last couple of years here in Mexico. Because I think I know, like, one of the questions that always concerns us is what to do, right? And that's like the hardest question to always answer in these exchanges. And so I don't pretend to know how to answer that question, but I think by maybe sharing an example of a project or a small autonomous organization that we have in Guerrero, it could at least get us thinking about the possibilities. So in the year 2014, in the region of Tixla, in the state of Guerrero, some of you might be familiar with Tixla, given that it's the location home to the Ayotzinapa Rural Teachers College, whose students were attacked, 3 were assassinated, another 43 were disappeared in 2014, actually. And so in 2014, I and others were invited by some folks from some of the communities that belong to Tixla by a group called the Crack PC, which is a group that started out in Guerrero in 1995 and have a community police and sort of this own autonomous structure of justice, and exists in this region of Guerrero as well. And in that year, some of them in the Tixla region were concerned with kind of wanting to work on other things besides security and justice. And so we're interested in healthcare. And so the first thing that we did upon visiting there was just to set up some consults and stuff, just to get to know folks and for them to get to know us, and to also start doing sort of like a community diagnosis and understanding what were the main healthcare concerns in the region. And from there, we invited folks who wanted to train as health promoters. And so it was really great that a bunch were interested, mostly women, and that's been sort of like a regular thing across the years, that it's mostly been women participating. And so we started setting up monthly workshops, pretty intense workshops, sometimes 2 days of work at a time, in which we started just like going through really basic stuff, like the usual classic stuff like anatomy, physiology, just understanding the body, illness, signs and symptoms, but always combining that with kind of like topics and workshop dynamics around the political, social, economic reasons behind illness and health, and in general and particular to that region. And I think the other thing that's been important about the work has been always combining local traditional medical practices with biomedical stuff, right? So there's been a lot of work to use to kind of recuperate this knowledge of the use of medicinal plants and just other, like, the local ways of thinking about healthcare and illness. And I think, you know, one of the first decisions of the Brigada 43, which is the name of our group, was to make sure to give free healthcare attention to anyone and everyone who asked for it, independent of their political affiliations, or even if they were on board or not with the community police. And so, you know, interestingly, like over time, the healthcare promoters of the Brigada have become important, I would say, reference points for folks for healthcare in their community, but also some of the surrounding communities. They were able to gain the trust first of their family members and then neighbors, and even folks who are kind of like on the opposing end of the project of the community police. And so at the beginning of the process, it wasn't uncommon for people to ask us what political party we were working for, because it's just so uncommon to have these projects that kind of do community service that don't want something in exchange. And I do think that an important point of healing that came through the Brigada's work that wasn't even anticipated was kind of like healing these divisions that have been perpetuated by political groups and parties with their like kind of populist campaigns, right? That are kind of cyclical every 6 years here. And other parts of our work, I think, have been really important also in terms of healing collectively, which has been to put into practice, even if it was just in one community, a distinct relationship between the knowledge and knowing of those of us formed in institutionalized or biomedical healthcare, and sort of that territorial knowledge held by folks from the community that has been passed on for generations, right? And to change sort of the power dynamic between what is the science of biomedical healthcare or medicine and what is the science of traditional medicine. And I think the ability also after a consult, when folks have offered payment in return for that, being able to say, we don't want to be paid, but if you want to support the work of the Brigada, like, you know, what you can support the next activity or participate or something like that in terms of changing sort of that monetary relationship, right, with service and with care. And I think finally, one of the other things that have been super important at the level of healing individually and collectively has been the participation and leadership of women of the organization, and that it was seen in the community that the women, many of the women were at the head of the Brigada, and that the men of the community police recognized that this healthcare work that they were doing and have been pushing forward has probably been the most important intervention that the community police has done or made, or one of the most important actions that it has taken in the community. So I think that has been super important. About after 2 years of starting this work and getting to know ourselves, in a workshop that we did about our fears and just sort of like, it was dealing with the repression, because Guerrero is a really intense place to live in terms of political, paramilitary, military repression. And so we did this workshop around all sorts of fears. And I remember one of the promotoras of the Brigada told us for the first time ever after 2 years of work that her dream as a child had been to be a doctor, and that she knew that that would never happen given just like issues of poverty and all of those barriers to access to education and everything. And I just remember how important that moment was for us, all of us, to understand the importance of the work that we were doing, even though I think sometimes day on and day out, it seems very little compared to like these drastic situations that we're living in. And so, you know, just to finish, finally, there's so much more to talk about in terms of the Brigada, and I'm sure we can talk about it in the questions and answers and just exchange. But I do want to say that these experiences with the Brigada, what we went through in the Montaña in May this year, I think have really turned on their head a lot of the ideas, you know, that the educational system and the healthcare system, not just here in Mexico, but all over the place, have put forward in terms of what it means to heal, what it means to be a doctor, who actually can get involved in healthcare work, and you know, all of these things that have kept us away from taking ownership over our own health in our communities. And, you know, for years I thought, and I was trained to think, that my principal duty and responsibility as a doctor was to find illness in an individual body and get rid of it, and that was healing. And I think it was through this collective work with the Brigada that I've actually started seeing healing and what it means to do healthcare work in this completely different way, which puts forward this idea of kind of making community to heal, right? That it's not just about looking at a cold or a pneumonia or a diarrhea and healing that, but what it means to come together and living differently so that we can feel that we're not just healing individually, but as a whole. So that's mostly what I want to share for now. And I'm open and glad to hear your comments and questions. Thank you so much.